After a sexual assault, getting a forensic exam as soon as possible can be vital to your health and well-being. Waiting just 3 days could have a devastating impact on your life.
Hello, my name is Kirsten Korsiak. I'm a detective assigned to the Houston Police Department's Special Victims Division Adult Sex Crimes Unit. We investigate sexual assault incidents that occur to persons ages 17 and older, that occur from a stranger or even someone you may know, such as an intimate partner, friend, or coworker. When a person is assaulted, it is crucial they receive a sexual assault nurse examination, commonly referred to as a SANE. During this examination, evidence can be collected, but more importantly, the victim can receive the medical and emotional support needed to start the healing process. Adult Sex Crimes works with numerous partners to aid victims in their journey of recovery. One of the organizations we work closely with in regard to SANEs is the Forensic Center of Excellence, also known as Texas F&E. I met with Dr. Kara Breeden there to discuss how their nurse examiners support victims on their journeys from assault to trial.
Dr. Breeden, nice to meet you.
Nice to meet you.
Yeah.
So what is Texas F&E and what is y'all's mission?
Texas Forensic Nurse Examiners is a nonprofit organization, and we were founded on the principle of really closing the gap in victim services. So it used to be that patients had to go from hospital to hospital looking for a place that had a qualified forensic nurse examiner to be able to do this specialized exam on patients, and that's just not the case anymore. We've really opened up the service area and been able to really expand so that victims really can have a service that they need at any time of the day in multiple locations. We partner with lots of different hospitals within our community to be able to provide forensic nursing services. We've had advocates on staff since day one, and since our inception, we have grown to offer other services like adult forensic interviews and counseling and those types of things. So we're really a victim service center aimed at bridging the gap in victim services in our community. Sometimes people have to go to the hospital. Sometimes injuries are significant and a hospital is really the best place for a patient. But after someone has been a victim of some type of trauma in regards to sexual violence or domestic violence, there are times that it's appropriate for them to be seen in a clinic environment.
So what does the forensic medical exam consist of?
So we like to say that it consists of 7 parts, and it really helps us explain and walk through the entire exam. So first and foremost is consent. Obviously, we want to always have our patients consent as we're doing this type of exam. There's a lot to this exam, right? So we want to really walk through the entire process. What does that look like? Understanding victims' rights, that's one of those big pieces of the consent process. So that's first and foremost, and that's really happens during that rapport building phase of our medical forensic exams. So the second part of our exam consists of the medical and forensic history. So always as medical professionals, we're assessing past medical history, past surgeries, those types of things. But then our forensic history, which is really the patient's words of what happened that brought them there to see us. We're very careful about how we document that. We use the patient's words in quotations. We don't summarize anything. We really want to value what that patient is telling us during that interaction. The third part of the exam is really just a head-to-toe assessment. As nurses, this is something we do all the time, but when we're talking about a victim of trauma, we really want to be assessing for trauma, for injuries. So we're going to document those on a body diagram. We're going to take photos of these. We're going to really make sure that the patient's okay from head to toe. So the fourth part of our exam consists of an anogenital exam. The fifth part of our exam is evidence collection, which is the part that people know the most, right? It's that magic white box that people see on CSI, but really and truly, it's just one very small part of what we do. So if a patient arrives to our facility within 120 hours of their assault, we can collect biological evidence, which can be either stored or sent to the crime lab, depending on the patient's preference. So the sixth part of our exam is medication and additional medical treatment. So we talk about STI prophylaxis, which stands for sexually transmitted infections. We talk about pregnancy and pregnancy risk factors. Maybe if someone was strangled, they have a need for a CAT scan or further medical evaluation. So that's really what we're doing in our part 6 of our exam. Part 7 is really our discharge planning. This is really where we're working with our advocacy partners so that we make sure that our patients have everything they need in their discharge process. So do they need to be connected to advocacy, or do they have counseling needs? Do they need shelter? So these are all those things we're kind of looking at in that final phase. And then really making sure that the patient has the tools they need as they leave us to continue whatever that process is that they've chosen, whether they're working with law enforcement or they're not working with law enforcement. We're really making sure that they understand all of their choices and the things that are happening in that phase of the process.
So why is it so important for a victim of sexual assault to get an exam?
So sometimes people come in, they've already engaged with law enforcement, they have a case number, and that's already the path that they're going down. But a lot of times they'll also just show up to one of our partnered facilities and they don't know what they want to do yet. And so we get to talk with them through that process. We can explain what that looks like to engage with law enforcement. We can talk with them what does it look like if you don't engage with law enforcement. So we're really lucky. The state of Texas allows us to collect that biological evidence within that 120 hours. And we are able to do the same exact exam for someone with or without law enforcement engagement. That evidence gets stored. They can think through things. They can process. They can start counseling if that's something that's going to help them make this decision. There's lots of things that a patient has to kind of go through and think through that help them make that decision. So even if you don't know what you want to do right now, we always encourage people to get the medical forensic exam, because at least we can do the exam, we can make sure your bodies are healthy, we can collect evidence for storage for later. So it really makes a huge impact on not only your health right now and in the future, but maybe future decisions that you wish to make later on down the road.
So if a victim wants to get a hold of you and your establishment to see one of your nurses at a local hospital, how would they go about that process?
So we've tried to make that very easy. We know people get information from a variety of different ways. So our website at txfne.com, we have a very easy drop-down menu that shows all of our partnered locations, or patients can simply call our hotline. It is answered 24/7 by a forensic nurse. So they're never talking to an operator. They're always talking to someone that understands trauma and understand what that victim has gone through.
Another option for victims needing a sexual assault exam is going to one of the many esteemed hospitals here in Houston. Jamie Farrell, a forensic nurse examiner for Memorial Hermann, walks us through that process.
Memorial Hermann is honored to take care of patients at a time that is so vulnerable for them.
For sexual assault victims, is there a specific time frame that y'all go by regarding medical and forensic examinations?
Those who have been sexually assaulted understand that the most crucial decision they make has to do with their health. Many of them are exposed to HIV transmission and they have a concern for that, but there's a limited time. There's only 3 days that we're able to give them HIV prophylaxis medication if they are a candidate. Evidence collection and preservation has a full 5 days. So you can see there's a disparity and how important it is for survivors of sexual assault to come in and get their health care taken care of. When the patient presents and says to the triage nurse, I've been sexually assaulted, I've been raped, we want them to first and foremost feel safe. So from that, they are able to have a discussion with them to say, you have choices, you have options, and then they have that conversation so that they feel like they are making their own choices, we're respecting that decision, and begin to empower them.
So what are some benefits that sexual assault victims get from coming to an actual ER, say here at Memorial Hermann, compared to going to like clinics elsewhere?
Memorial Hermann and all of our hospitals, we have 11, and the adult patient is able to not only get their health issues addressed of sexually transmitted infection, emergency contraception, and HIV exposure, but from head to toe, that trauma assessment. And whatever is identified, able to have those x-rays completed, any other tests, radiographs that are needed for that of strangulation, any lab work that is needed. So the entire health aspect, as well as patients with self-harm, any concern, we have the psych response team, so the surround sound of physical, emotional, psychological, the holistic care of the patient. Many times that trauma, what has happened to them, they don't even realize that they have physical injury. And so it's so important. Memorial Hermann is able to do that assessment, not only address sexually transmitted infection, emergency exposure and HIV exposure, but to do x-rays and lab work and identify any other aspects that need to be taken care of for their health.
So along with your sexual assault care, what other support does Memorial Hermann offer victims?
Memorial Hermann, first and foremost, addresses their physical needs. We assess their emotional needs, their psychological needs, and with that, it's a community partnership with that of our Red Cross centers, that of law enforcement. We want survivors to know, we want them to move from victim to be victorious survivor. And doing that is helping them know that there's a community of resources ready to support them. Another is support for clothing replacement that different agencies donate for this patient, which is so incredibly generous and makes a difference in their healing. There includes toiletry packets and then fresh new clothing, sweat bottoms, tops, and undergarments so that they are completely outfitted when they leave.
As you've heard, sexual assault examinations are very important after an assault. They ensure victims are healthy and medically treated if needed. They can also offer psychological services and aid in any criminal investigation if a victim so chooses. Adult Sex Crimes encourages all victims of sexual assault to get a SANE as soon as possible at either the 2 facilities mentioned previously or any other medical facility. Remember, if you are unable or not mentally ready for the SANE, you have up to 120 hours after the assault to get one completed. Even if you miss the 120-hour window after an assault, victims can still request what is called a non-acute sexual assault examination to address their medical and psychological needs. Please be aware, not all medical providers offer this examination. Many clinics like Texas FNE do. You will need to check with your medical professional to see if this option is offered in your area. Above all, know your assault is not your fault and there is help and support for you. You can get through this.